Welcome to Wanda's Patient Management Platform, your tool for monitoring patient data. The Wanda platform empowers doctors and clinicians with the ability to know when patients will have adverse events before they happen, predicting 90% of rehospitalizations and emergency department visits before they occur. I'm going to walk you through registration, monitoring, intervention, and scheduling for our high-risk patient, John Oldhart. John has just been discharged from the hospital, and my team will be taking care of him. To begin John's registration, I will log into Wanda and choose to add John as a patient. I'll fill out his demographic information and assign myself as a care coordinator so that John appears on my monitoring page when I log in. As I'm filling out the rest of the required information, I notice that Programs is a required field. This is where I'll enroll John in a clinical program based on his condition. John has a diagnosis of congestive heart failure, so I choose our CHF program, set today as the start date, and set the end date to 30 days in the future. I'll finish filling out registration information and save John as a patient. A few days have passed since John was registered and set up with his Wanda Health Kit. When I log in, I see John's name at the top of my page with an exclamation point. This means that his reported health data has caused the system to trigger an alert. I can see that his weight triggered the alert because it's highlighted in red, and I can view his weight trends. I want to understand more about John's holistic health information before deciding on my intervention, so I'll click on his name to navigate to his patient health record. I see the reason for the alert and the specific data at the top of the page in red. It looks like he had a larger than average one-day weight increase. I want to see a trend of his weight, so I'll click on the Charts tab to see historic values. At this point, I'll follow my agency's care plan assessment and alert intervention process. I'll document my intervention in a note on the right side of his patient health record by choosing the correct trigger and intervention and writing anything else I'd like to include. As part of my intervention, I spoke to John on the phone, and he said that he was having trouble seeing the tablet and that he'd like to receive his daily survey over the phone instead. I'll schedule those check-ins now by clicking on the Schedule tab on his patient health record. I'll choose which survey I'd like to schedule, choose the IVR or interactive voice response method, choose the language, and then make sure I like the order of the questions. I usually ask patients about their shortness of breath before their vitals, so I'll move that question above vitals. When I'm happy with the order, I'll choose Next and continue with the schedule specifics. John said that he'd like to receive his call at 9 a.m. after he eats breakfast, so I'll schedule it for that time. I'd like the system to try calling him again if he doesn't pick up. I'll choose tomorrow as the start day and 30 days from now as the end date. I'll choose Add Schedule to finalize the schedule. Since John doesn't want to use the tablet anymore, I need to set up an appointment for our nurse to pick it up from his house. I'll have the system give John a reminder call 30 minutes before the scheduled pickup. To schedule the reminder, I'll click on the Reminders tab and then choose to add a reminder template. I'll only need to create this template once, and then I'll be able to use it for all of my patients moving forward. I'll choose Add Template and then fill out the specific fields in the template. I'll give the template a name, write a generic opening line, and a generic main message. I will authorize 2 responses, a confirmation and a reschedule. I'll type a generic message in the case that the patient chooses the reschedule option, and I'll type a quick thank you message. Once created, I'll use this template to schedule the device pickup reminders for all of my patients. I'll navigate back to John's page, choose Reminder, and then choose to add a reminder. In this pop-up, I'll choose the template that I just created, which will populate the reminder with that information. I'll edit the time and date of the reminder to later today, and edit the pickup time in the body of the message. Once I select Submit, the reminder will be scheduled, and I'll be able to view it and cancel it in this tab of the patient health record. I'll make sure to monitor his response from the Reminders tab just in case he wants to reschedule. I'm done monitoring John, so I'll move on to my next patient for the day. We've just seen registration, monitoring, intervention, and scheduling in Wanda's patient management platform. Thanks for joining me in my monitoring process today.